Hello students, we are back to mind map format. Today we are going to see quick revision of different health committees in short concise points in a single slide. Historically, the health planning in India began with Boer Committee in 1946, which provided comprehensive proposals for developing a national health service program emphasizing preventive and curative health work. Thereafter, multiple health committees were appointed. Today we are going to see the concise presentation of these committees. First is Boer Committee. First comprehensive proposal for National Health Services was given by Boer Committee only. Recommended integration of preventive and curative services by Boer Committee. It proposed primary health center with detailed staffing first time in Boer Committee. Suggested a two-stage development of health infrastructure, emphasized preventive health work alongside patient treatment, and recommended major changes in medical education. Second is Mukherjee Committee in 1962. It reviewed the progress since Boer Committee, found primary health centers quality inadequate. So it recommended consolidation of existing healthcare advances, strengthening district hospitals with specialist services, creating regional health organizations, limiting each PHC to 40,000 population, integrating medical and health services, proposed an all India health service. Then third is Chada Committee in 1963, that is just a year after. It focused on National Malaria Eradication Program and it recommended malaria vigilance operations to be handled by General Health Services, one basic health worker per 10,000 population, multi-purpose workers to handle malaria, vital statistics and family planning. Next we have Mukherjee Committee in 1965-66. This Mukherjee Committee recognized ineffectiveness of multi-purpose workers, so it recommended separate staff for family planning and it recommended delinking malaria activities from family planning. In 1966, the committee again gave some recommendation. It worked out basic health services to be provided at block level and addressed challenges of states in managing mass health programs. This is followed by Jhunjhunwala Committee in 1967. It defined integrated health services and it recommended unified approach to health problems, integration of services at all hierarchy levels, unified cadre and common seniority, and elimination of private practice for government doctors. It emphasized integration as an evolutionary process. So, in 1960s, we have four committees. We have Mudaliar Committee, Chada Committee, Mukherjee Committee, Jhunjhunwala Committee, everything operating in that decade, four committees. Then in 1973, Kartar Singh Committee, it studied the multipurpose workers in health and family planning and it recommended replacing the existing health workers with designated male and female health workers, implementing multipurpose worker program in phases, one PHC per 50,000 population, dividing PHC into 16 sub-centers and detailed supervisory structure for health workers. Next, in 1975, Srivastav Committee came. It focused on medical education and supports manpower. The key recommendations were creating community level health workers, establishing two cadres of health workers, developing a referral service complex, creating a medical and health education commission for the first time, and it proposed one male and female health worker per 5,000 population. Then in 1977, Rural Health Scheme. This was implemented by Srivastav Committee's recommendation, initiated training of community health workers, involved medical colleges in rural health care, and reoriented health worker training. This is followed by Working Group on Health 1981. It was constituted to outline Health for All by 2000 strategy because it was formed after Alma Ata conference. It set specific health indices and targets and it developed approach for 6th 5-year health planning. Actually, each committee was built upon previous ones, gradually evolving India's healthcare strategy towards more integrated, community-focused and comprehensive health services. So this short mind map of committees will be useful for your exams. Write this in your exams.